Yes, just testing it for a while. All right. So good evening. Can you hear me now? Can you hear me now? Good evening, Akshi, Yukti, Supriya, Akash. Yes, this is live. Anmaika, Anne, Akash, Shagun, Avni, Yukti. Good evening. Can you hear me? Can somebody tell me whether am I audible, visible? So good evening. Can you hear me now? Yes. Yes. So I think yes. So I think you can hear. Yes. Probably you need to refresh and then you should be able to hear. All right. So welcome once again. And like I started off, this is a demo class in physiology, and I'm Dr. AnupamaChawdharyDevganand. I'm a physiology faculty with DAMS for the last 16 years, and this is my 17th year. And what I would like to mention before we start off on this very interesting topic of glomerular filtration is that physiology is a relatively high yield subject, relatively easy to master. And there is a lot of focus on physiology, which we saw in the INI-CET, which was held last month. A lot of physiology questions were asked. Physiology is literally your foundation of medicine, right? And if you know your physiology, pathology, pharmacology, medicine is cakewalk. So focus on physiology, especially with the shift towards integrated questions, towards application-based questions, it becomes relatively important to focus on physiology, right? So today I'm taking up a very simple topic with you, glomerular filtration, but as we go along, I'll tell you about the kind of graphical questions which have been asked, which can be asked from this relatively simple topic. But there are some very, very important points that you must know about glomerular filtration. So let's have a look first at the glomerular filtration membrane. Now, as far as the glomerular filtration membrane is concerned, there are three layers. Three layers is a glomerular capillary endothelium. This is layer 1. The glomerular capillary endothelium is the first layer. And this is a fenestrated endothelium. This is a fenestrated endothelium. What do you mean by a fenestrated endothelium? That means there are large pores. As you can see over here, this is the endothelium which has got large pores, right? And these pores are 70 to 80 nanometers in size. 70 to 80 nanometers in size. Right? Yes, of course. R. Mansuri, absolutely right. This was asked in INI-CET. That is why I've decided to take this in a little detail. So 70 to 80 nanometers in size. These are the size of the pores or the fenestrae that you see in the glomerular capillary endothelium. Then the second layer is the basement membrane. Basement membrane has got the presence of sialoproteins or proteoglycans. There are sialoproteins which are present. A lot of people believe that the sialoproteins are also present in the glomerular capillary wall. Sialoproteins, and these impart a negative charge to the basement membrane. Now with the visceral layer of the Bowman's capsule, this is the visceral layer. If you can see this, this is the Bowman's capsule has got a parietal layer, and it also has a visceral layer. And this visceral layer of the Bowman's capsule is modified to form podocytes. It is modified to form podocytes. And what are these podocytes? They have foot-like processes, which is called pedicels. Foot-like processes. These are the foot-like processes that you can see, right? And these, like I said, are known as the pedicels. Foot-like processes, and between the foot-like processes, there are gaps, which are called filtration slits. And what is the size of the filtration slits? These are 25 nanometers in size, right? If you look at the basement, the glomerular capillary endothelium, fenestrated, large pores are present, and you've got the basement, the basement membrane is the second layer, and the visceral layer of the Bowman's capsule is modified to form podocytes. Filtration slits are present. The size of the filtration slits is 25 nanometers. Now that means, now if you look at the basement membrane, a little more detail, the basement membrane has got no pores. there are no pores which are present in the basement membrane. There are no pores which are present, but its permeability is equivalent. Permeability is equivalent to a pore size. It is equivalent to a pore size of 8 nanometers. It is equivalent to a pore size of 8 nanometers. It does not have any pores, but the permeability of the basement membrane is equivalent to a pore size of 8 nanometers. So my first point over here is, what is the limiting factor for filtration? What is the limiting factor for filtration? The limiting factor for filtration is going to be the basement membrane. Basement membrane will be the limiting factor for filtration. The fenestrae are relatively, fenestrae and filtration slits are large in size. Therefore, what is going to be the limiting factor for filtration? That is going to be the basement membrane. Next important point is neutral particles. Neutral particles more than 8 nanometers are not filtered at all. They are not filtered at all, right? More than 8 nanometers will not be filtered at all, right? And the obvious reason is the basement membrane, which is the limiting factor for filtration. On the other hand, neutral particles less than 4 nanometers are freely filtered. Freely filtered, right? Neutral particles between 4 and 8 nanometers, filtration is inverse to size, right? It is inverse to size. And of course, it is also determined by the charge on the particle, right? So neutral particles more than 8 nanometers will not be filtered at all. Less than 4 nanometers freely filtered. Between 4 and 8, it is inverse to size. Yes. Now, and of course, charge is also going to be a very important determining factor. Now, here comes a question: which of the following has the least filtrability? Which of the following has the least filtrability? Is it going to be 4 nanometers negative, 4 nanometers positive, 7 nanometers negative, 7 nanometers positive? Now, what is going to have the least filtrability out of all of these? Remember, I said charge is also important. The basement membrane has got a negative charge. So what is going to have the least filtrability over here is 7 nanometers negative. This is going to have the least filtrability, and this is albumin. The effective diameter of albumin is 7 nanometers, and albumin is in fact an ellipsoid particle, and it has got a negative charge. And if you look at this, least filtrability will be for a substance which is 7 nanometers and negatively charged, and this is albumin. Effective diameter of, when I say effective diameter of albumin, what do I mean by that? Like I said, albumin is ellipsoidal. It's elongated kind of a molecule, which is in the length is approximately 15 nanometers. This width is about 5 nanometers. Effective diameter of albumin is 7 nanometers. Now, even though this is less than 8 nanometers, but because of the negative charge, it has a very, very little filtrability. Of course, some albumin, the albumin present in the glomerular filtrate is hardly 0.2% of the albumin in the plasma. Have you understood? So this is going to have the least filtrability, like I said, because it has a negative charge. Yes? Now, the next important point as far as the filtration membrane is, this is another diagram over here, trying to tell you that the plasma is filtered. There are these fenestrations which are present, and then the basement membrane, which has no pores, but the permeability is equivalent to a pore size of 8 nanometers, and the filtration slits. So this is more of a diagrammatic representation. Again, another diagram which I want you to look at. This is basically trying to tell you that the blood will come via the afferent arteriole. It goes into the glomerular capillaries. Yes, and then exits via the efferent arteriole. So literally this is acting like a sieve. It's acting like a sieve. So what is going to be filtered is the plasma. The glomerular filtrate which is formed, the glomerular filtrate will come here into the Bowman space. This is an ultrafiltrate of plasma. When I say ultrafiltrate of plasma, what do I mean by that? That means the filtrate which is going to be formed is basically plasma minus the plasma proteins. Have you understood? Proteins are not going to be filtered. I've already told you the reason why. Right? The albumin is in fact got the least molecular size. All other proteins are much larger in size. Plus they have the negative charge, so they're not going to be filtered. Right? So the ultrafiltrate, glomerular filtrate is going to be an ultrafiltrate of plasma. This is basically plasma minus the plasma proteins. Plasma minus the plasma proteins. Now, this was another interesting question, which in fact, this is the exact question which was asked in the INI-CET this time, as Aryaman was saying. Now, what is this basically? This is basically trying to tell you that if we take dextron can be, dextrons, these are synthetic molecules, they can be neutral, they can be anionic, or they can be polycationic. Now, if I see the relative filtrability of a neutral substance, polycationic, polyanionic substance of the same size, what do I find? Let's take a dextron of an effective diameter of 30 angstroms. 30 angstroms or 3 nanometers. We find that the one which has got the maximum filtrability will be a polycationic dextron. Positive charge on the molecule. This will be relatively easily filtered as compared to a neutral dextron of the same size. Which one will have the least filtrability will be a polyanionic dextron, and makes sense because of a negative charge on the dextron molecule. Have you understood? So this is basically trying to tell you that even if you take the same three substances with same effective molecular radius, the one which has got a positive charge will be more easily filtered as compared to a neutral particle of the same size as compared to and the least filterable will be a molecule with negative charge on the surface. And this was the INI-CET question which was asked. It says the adjoining graph depicts filtrability of dextron through the kidney. 1 representing complete filtrability, 0 representing no filtration. Which of the following are A, B, C respectively? So what is the one, which is the one which is going to have the maximum filtrability? That is going to be a cationic, then B is neutral, and A is polyanionic. So my answer to this question is A is polyanionic, B is neutral, C is polycationic. This is going to be my answer. This was the INI-CET question which was asked. Now the next important point is, what are the pressures which are going to be responsible for filtration? Now when we look at filtration, there are hydrostatic pressures and there are colloid osmotic pressures which are going to be responsible. Now what is the hydrostatic pressure? What is the hydrostatic pressure? Hydrostatic pressure is a push force. It is going to push the fluid. H in hydrostatic, H in push. So it is going to push the fluid out of the glomerular capillary into the Bowman space, So what is this is the pressure that I'm talking about. This is called PGC. Hydrostatic pressure, GC is glomerular capillary. This is a push force, and you can appreciate the direction of the arrow. It is pushing the fluid out of the capillary into the interstitial space. So this is the push force. Have you understood? And I've made it with a very thick arrow because this is a very large force. Very large force. Have you understood? In fact, it's the largest out of the 4 forces which are responsible for filtration. So this is PGC, hydrostatic pressure of the glomerular capillaries. Then there is yet another force which is going to pull the fluid back, and that is called the colloid osmotic pressure. And this is going to be the pull force which is pulling the fluid back into the capillary. So this pressure, this is now known as pi GC. What is pi GC? Colloid osmotic pressure of the glomerular capillary. This is the pull force. Yes. So 2 forces, push force, and opposing this push force is the pull force, which is pi GC. Similarly, there is a push force in the Bowman's capsule, and this push force is PBC, hydrostatic pressure of the Bowman's capsule. Now, this is pushing the fluid from the Bowman's capsule into the capillary. It is pushing the fluid from its own space into the capillary. And there is a pull force over here which is going to pull it back. Have you got my point? Right? So you've got these 4 forces. 2 for the glomerular capillary, 2 for the Bowman space. But you have to appreciate the direction of the arrows. Now, which are the forces which are favoring filtration? PGC. PGC is favoring filtration of fluid into the Bowman space. Remember, I told you, the capillaries are acting like a sieve. Have you understood? And the fluid will pass from the sieve into the Bowman space. So forces which are favoring filtration are PGC, and the other one which is in the same direction as PGC is pi BC. This is also trying to pull the fluid into the Bowman space. But what is opposing the filtration are 2 forces, pi GC and PBC, because look at the direction of these arrows. This is from the Bowman space into the capillary. The 2 forces which are favoring filtration, PGC and pi BC. The 2 forces which are opposing filtration. Appreciate the direction of the arrows. Yes? So the ones which are favoring filtration will be written with a positive sign. So what is my net filtration pressure? Let's see the net filtration pressure. The net filtration pressure is going to be PGC minus pi GC minus PBC plus pi BC. The 2 forces which are favoring filtration, PGC and pi BC, these are positive, and the ones which are opposing filtration will be negative. This is going to be your net filtration pressure. Net filtration pressure, PGC minus pi GC minus PBC plus pi BC. Now, numerically, how much is this? PGC is in fact a very large force, so this is about 45. Pi GC in the glomerular capillaries is 20 approximately. This is 10 and pi BC is 0. Why is pi BC 0? Because there are no proteins in the glomerular filtrate. I told you that the glomerular filtrate is an ultrafiltrate of plasma. This gives me a net filtration pressure of 15 millimeters of mercury. Now, a lot of books have said that the net filtration pressure is 10 millimeters of mercury, but a slightly safer answer is 15, right? Both are correct. There are references for both of these, but like I said, this is 15 is the 15 millimeters of mercury is a much better answer. Right? So, thank you, Donald Modi, Nightingale of Physiology. Oh, that's very sweet. Thank you, Saurav, for all your love. And Yukti, yes, I will explain this once again, and that is PGC, pi GC, PBC, pi BC. Right? These are the 4 forces. GC standing for glomerular capillaries and the BC standing for Bowman's capsule. Yes? Now, remember, the hydrostatic pressure will push the fluid, colloid osmotic pressure will pull the fluid. So hydrostatic pressure of the glomerular capillaries will push the fluid from the glomerular capillaries into the Bowman space, and the colloid osmotic pressure will pull it back. Bowman's capsule hydrostatic pressure will push the fluid from the Bowman space into the capillaries, and the colloid osmotic pressure of the Bowman's capsule will pull it back. So that means which are the forces which are favoring filtration, that we will indicate with a plus, that is PGC and pi BC. These are the two forces which are favoring the movement of fluid from the capillaries into the Bowman space. And what is opposing it is pi GC and PBC. Look at the direction of the arrows. So these will be indicated by a negative sign. So your net filtration pressure is 15 millimeters of mercury. Now, one very important and a very small point, but can be asked. Now, we said the PGC is 45 millimeters of mercury. Whereas if you look at the hydrostatic pressure in most capillaries, the hydrostatic pressure in most capillaries, it is in fact much lower. The hydrostatic pressure in most capillaries, this is generally about 35 millimeters of mercury. So why is this pressure much higher than the hydrostatic pressure in most other capillaries? There are two reasons. Why is the PGC higher than the hydrostatic pressure in most capillaries? There are two reasons for it. Number one, the glomerular capillaries are relatively direct and straight branches of the interlobular arteries. These are relatively direct and straight branches of the interlobular arteries. Right? What do I mean by that? See, normally, when you look at the, or before I write glomerular capillaries, I should write afferent arterioles. Right? These are relatively direct and straight. See, what do I mean by that? See, every artery will divide into smaller arteries and then yet smaller arteries and still smaller arteries and finally form the arterioles, capillaries. So what happens is the number of divisions between the interlobular arteries and the glomerular capillaries are much less. So pressure in the afferent arteriole and therefore in the hydrostatic pressure in the glomerular capillaries is higher than in the capillaries of other tissues. Have you understood? Right? And the second is, of course, the efferent arteriolar diameter is less than the afferent arteriolar diameter, so that also causes the glomerular capillary hydrostatic pressure to be higher than the hydrostatic pressure in most tissues, right? So two reasons for this. Like I said, the afferent arteriole is relatively direct in a straight branch of the interlobular arteries, and the efferent arteriolar diameter is less than the afferent arteriolar diameter. Yes? Yes, Akash Verma, this is a demo class, right? This is till 5:45, till 5:45. All right. So I've already discussed with you what is the net filtration pressure. This is 15 millimeters of mercury. Now, what is the connection of this? How is this net filtration pressure related to GFR? Now, GFR is directly proportional to the net filtration pressure. Net filtration pressure, right? Directly proportional to the net filtration pressure. That means it is directly proportional to PGC minus pi GC minus PBC plus pi BC. Right? And if I want to remove the proportionality sign, if I want to bring an equal to sign, I have to multiply it by a constant, that is KF, into PGC minus pi GC minus PBC plus pi BC. And what is KF? KF is your ultrafiltration constant. This is your ultrafiltration constant. And when I say ultrafiltration constant, this is a product of permeability and the surface area. Capillary permeability, or sometimes also called capillary conductivity, and the surface area, right? So GFR, these are the factors which are going to affect GFR, and that is That is capillary permeability will be the first one, which is going to affect GFR. Number 2, surface area. Number 3, hydrostatic pressure of the glomerular capillaries. Number 4, BIGC, PBC and BIBC. So these are your 6 factors which will control the GFR. Have you understood? They will affect the GFR, not control, they will affect the GFR. Capillary permeability, surface area, PGC, BIGC, PBC, BIBC. Right? Please understand the forces which have got a positive sign in front. That means PGC and BIBC, these are favoring filtration. BIGC and PBC are opposing filtration. Now the next important point is, what do you understand by filtration fraction? Now what is filtration fraction? Now filtration fraction is GFR divided by renal plasma flow. See, after all, what is this glomerular filtrate? Glomerular filtrate which is going to be formed. The glomerular filtrate which is formed, this is an ultrafiltrate of plasma. This is an ultrafiltrate of plasma. When I say ultrafiltrate of plasma, what do I mean by that? That means it is a ultrafiltrate of plasma, means that it is basically plasma minus the plasma protein. So what is filtration fraction? Filtration fraction is out of the entire amount of plasma which flows into the kidney, how much of it is going to be filtered to form the glomerular filtrate, right? And how much is normal GFR? This is 125 ml per minute. How much is renal plasma flow? Approximately 625 to 650 ml per minute. If you see this, this is 0.20, or the range is 0.16 to 0.20, or you can write it as 16 to 20%. What does this mean? This means that out of the entire amount of plasma which is flowing into the kidney in unit time, 20% of this is being filtered to form the glomerular filtrate. 20% is being filtered. Range is 16 to 20%. 16 to 20% is being filtered to form the glomerular filtrate. Now, what do I mean by that again? If I see this Bowman's capsule, afferent arteriole, glomerular capillaries, efferent arteriole. Supposing I have a substance, let's say the amount of that substance here is 100. This is a freely filtered substance. This is a freely filtered substance, right? An arbitrary figure I'm taking is 100. That means how much is going to be present in the filtrate? 20. 80 will be left behind. Have you understood? That is what is meant by a filtration fraction of 20%. You cannot have 100% of the substance filtered in one circulation. A maximum of 20 will be filtered in one circulation. 80% is left behind. That 80% will come back again into the kidney in the next circulation, and another 20% will be filtered. Then in the third circulation, another 20%, and so on. By repeated circulations, you will be able to eliminate this substance in the blood, from the blood. Have you understood? So this is what is meant by a filtration fraction of 20%. But please understand, filtration fraction is 20%, but the glomerular filtrate which is formed is isotonic with plasma. Concentration of the filtrate is the same as plasma. Ionic composition of the filtrate is the same as plasma, except it has no plasma proteins. But it is 20% of the plasma flow. So there are two different points here. The filtrate is 20% of the plasma flow, but the composition of the filtrate is the same as plasma. The glomerular filtrate is isotonic with plasma. Let's see the next point which I want to make over here. Now this is a very, very interesting question. This says, which of the following increases from afferent to the efferent arteriole? That means if this is afferent arteriole, glomerular capillaries, efferent arteriole, this is the afferent arteriole, blood moves in here. This is the glomerular capillary and the efferent arteriole. Yes? Fluid is filtered from the glomerular capillaries into the Bowman space. Into the Bowman space. Yes. So the question says, which of the following is going to be increases from afferent to efferent arteriole? Now this is a very interesting question. Which of the following forces are going to increase? Now remember, fluid is being filtered. Fluid, that means water, ions, these are being filtered. Glucose, amino acids, freely filtered. But what is not being filtered are the proteins. Proteins are being left behind. And what pressure are the proteins responsible for? They are responsible for the colloid osmotic pressure. So if water and other ions are being filtered and other substances are being filtered, proteins are not being filtered, the concentration of proteins will keep on increasing from the afferent to efferent arteriole. So the glomerular capillary colloid osmotic pressure will show you an increase. The concentration of proteins rises and the glomerular capillary colloid osmotic pressure will increase. Yes, so this is a very interesting question. What will happen? Please remember, Bowman's capsule hydrostatic pressure is not going to show an increase because whatever fluid is formed, it moves ahead. It does not stay there. It moves forward. So it is not going to increase the Bowman's capsule hydrostatic pressure. The only pressure that is going to rise is the glomerular capillary colloid osmotic pressure. And there is an interesting graph for this. This shows you what is going to happen to the glomerular capillary hydrostatic pressure. Now, colloid osmotic pressure first, glomerular capillary hydrostatic pressure, which is about 45. This is what is going to happen. It is almost static, PGC. But what is going to happen to pi GC? Pi GC was 20 to begin with. As you go towards this is your pi GC. This shows an increase from afferent to the efferent arteriole. So what is going to happen to the net filtration pressure? Net filtration pressure, this will show you this is now going to decrease at the afferent arteriole, and this is towards the efferent arteriole. Pi GC is increasing because filtration of fluid is increasing the concentration. Why does it increase? Pi GC increases from the afferent to efferent arteriole because there is no filtration of proteins. Everything else is being filtered except proteins. So concentration of proteins, this causes an increase in the concentration of proteins and therefore increases the pi GC, colloid osmotic pressure. What is colloid osmotic pressure? This is dependent on the proteins. So if the protein concentration rises, there will be increase in the colloid osmotic pressure. Colloid osmotic pressure, right? Okay. Now, here is another one. This is again an interesting graph. A lot of us are very scared of graphs. Yes, even the ones who have been studying for more than 1 year, 2 years, they're still scared of graphs. Graphs are nothing to be scared of. Focus on what is given on the x-axis, what is given on the y-axis. Now, in this graph, what am I trying to show you? I'm trying to show you that the Mamta Dhanwani PGC is not going to show you too much of a decrease, is mainly because, please remember, this is a dynamic situation. What is PGC? Hydrostatic pressure. This is a pressure due to a column of liquid. Pressure due to a column of liquid. Have you understood? So this column of liquid, because there is continuous flow from the afferent arteriole, the column of liquid is being maintained, so you do not see much change in PGC. Is that understood? Mamta Dhanwani? Right? There is not much change in PGC. This column of liquid is going to be maintained. Okay? This is, there is not going to be much change in PGC. Yes? Sitakshi, I'm an inspiration for you. Thank you so much. And I would, the only thing which sort of every teacher, and I say this for all of us in DAMS, is what we look for is that you should put in your best. We want you to achieve your dreams, and we want to help you in this journey. This is a very difficult journey. This is probably the toughest exam that you're going to face in your life, much tougher than your UG entrance exam. This is definitely a very, very difficult exam, and we want to hold your hand during this journey, and we want to help you in whatever way we can. And so when I see that there is a concept which you have understood, it gives me such joy. And I'm not saying this because it's something which is coming from my heart. It gives me so much of joy if I can get the message across to my students. Right? All right. Okay. So let's see this. Now this is an interesting graph. Like I said, whenever you get a graph like this, please see what is on the x-axis, what is on the y-axis. Now this is showing you afferent end and towards the efferent end. And this on the y-axis is the glomerular colloid osmotic pressure. This is telling you that the glomerular colloid osmotic pressure is increasing from the afferent to the efferent end, which I've just told you. Why does it increase? Because of filtration of fluid, but no filtration of protein. So protein concentration will rise. Now I've brought in another interesting concept here, and that is, what happens if I increase the filtration fraction? Yes? What was filtration fraction? Filtration fraction is GFR divided by the renal plasma flow. So if I increase the filtration fraction, how can I increase the filtration fraction? If I increase the numerator, if I increase the GFR, yes, filtration fraction will rise. More GFR means what will happen to the colloid osmotic pressure? Colloid osmotic pressure, pi GC, will show you a greater rise. Have you got this point? More the filtration fraction, instead of 20% of fluid being filtered, let's say 25 or 30% is being fluid is being filtered, you find a greater rise in the colloid osmotic pressure. And if there is a decrease in the filtration fraction, what is going to happen? Instead of 20% of fluid, let's say 15% of fluid is being filtered. The rise in pi GC will be less. Have you got this? Right? So these are some very, very basic concepts which I tried to discuss with you today. This is, like I said, what will happen, let's have a look at what we have just done today. Let's see. Okay. This was a demo class, so a relatively short class. Glomerular filtration membrane, what are the three parts? What is limiting filtration? Basement membrane. Limiting factor for filtration is basement membrane. Neutral particles more than 8 nanometers are not going to be filtered at all. Less than 4 nanometers are freely filtered. Between 4 and 8 nanometers, filtration is inverse to size. I took an important question, which has got the least filtrability. This is going to be 7 nanometers negative, which is albumin, right? Albumin has an effective diameter of 7 nanometers. It has a negative charge, so it is relatively less. It is in fact almost zero, just about 0.2% of the plasma concentration of albumin is present in the glomerular filtrate. Yes, the glomerular filtrate is an ultrafiltrate of plasma. It is plasma minus the plasma proteins. I discussed with you that what is going to happen if you have same sized particle, a neutral particle, a cationic particle, and a anionic particle. A cationic particle will be filtered more than a neutral particle. Least filtrability will be for a polyanionic particle of the same size. This was the INI-CET question which came. So I have discussed that with you. What are the pressures responsible? PGC, pi GC, PBC, pi BC. The net filtration pressure is PGC minus pi GC minus PBC plus pi BC. Forces which are favoring filtration, PGC and pi BC. Forces which are opposing filtration are pi GC and PBC. Right? Why is PGC higher? This is because the afferent arterioles are relatively direct and straight branches of interlobular arteries, and efferent arteriolar diameter. Efferent arterioles are narrower. So if they are narrower, that means more resistance. More resistance means hydrostatic pressure in the glomerular capillaries will be higher. Yes. Then what is net filtration pressure? We discussed that. How does it affect GFR? These are the six factors which affect GFR. And I discussed with you filtration fraction. I discussed with you which force is going to increase from afferent to efferent arteriole. Glomerular capillary hydrostatic pressure. Yes. And why will it increase? Because there is no filtration of proteins. And I discussed with you an interesting graph. What happens if there is increase in filtration fraction and to the PGC, and what will happen if there is a decrease in filtration fraction? What will happen to PGC? So this is from me today as far as glomerular capillaries, glomerular filtration is concerned. And of course, we can go on and on. There is so much more to discuss. Factors affecting the regulation of GFR. We can go on and on, right? Okay. Oh, great, Nupur. I'm so glad that you have been able to understand this. I'm so glad, Ashutosh. Thank you so much for your compliments, Shambhavi. Thank you so much, right? I will, of course, there are many more demo classes, and basically what I'm going to do in my demo classes is also include topics which have been recently asked and which I can sort of spend a little time on, right? Any problems that you might have, anything that I can help you with, my email, drAnupamaDevgan@gmail.com. You can also message me on Facebook. You could also, Dr. Anupama's Physiology is my Facebook page. In case you're not members of the exclusive club, you can ask your questions there. More than happy to answer. Mamta Dhanwani, thank you so much for your compliment. And Avni, thank you so much. Ashutosh, thank you so much. This is also, if you are going in for the fast track TNDs, you can write a referral code, which is a referral code, that is DRANMED 974 to get a 10% discount. This is for all app-based courses, whether it's the Ultimate Live course or the TND. You can use this referral code to get a 10% off. All right. Yes. Thank you so much. Right. See you next time. Doubt won't be conducted for NEET, Shaurav. What is that? I'm sorry. Doubt classes for NEET. Next year. Nupur, thank you. Yukti, please explain the last point of the graph. See that the last graph was in filtration fraction. More the filtration fraction, more fluid is going to be filtered, larger increase in colloid osmotic pressure of the glomerular capillaries. Less the filtration fraction, lesser increase in the PGC from afferent to efferent arteriole. Right? Okay, so thank you so much and see you next time. And let me know if there is any topic that you want to cover. So in my next demo class, I can cover that for you. You can email me. You can also send me a message on my Facebook page, which is Dr. Anupama's Physiology. This is on Facebook. And in case, all right, thank you so much. Thank you so much and bye-bye.